All right, this is Module 7, Transcultural Nursing Presentation for Group 4, Summer Blackman, Crystal Nowoc, and Megan Kessel. Our group chose to present our presentation on Latino culture in today's healthcare due to its large percentage in our population. When talking with each other, we all realized that the Latino population is very present in our healthcare settings and often poses challenges due to differences in beliefs, values, healthcare practices, and language. We hope that this presentation will accurately reflect this culture and the nursing considerations across the lifespan. The Latino culture broadly encompasses Spanish-speaking immigrants from many countries including Mexico, Puerto Rico, Colombia, Dominican Republic, and Panama, making up approximately 16% of the U.S. population. Some of the beliefs of this culture are included here on this slide, such as good health as a result of good luck or reward, and poor health as a result of punishment for some transgressions. These beliefs, therefore, often eliminate or strongly diminish personal accountability of the patient for their health. Latinos also believe in traditional healers, wizards and witches, herbalists, midwives, and many other versions of folk medicine. The traditional healers traditionally distinguish illnesses as hot or cold conditions. It is important to note, however, that temperature is not the key factor in the classification scheme. For example, linden tea, though served hot, is considered cold and is used to treat hot ailments. Acceptance, therefore, of the hot and cold system can greatly affect compliance with treatment. Values of the Latino population are also very important. Addressing the adults by title and family name while making eye contact and speaking directly to the patient, even when using an interpreter, shows respect. Relationship or personalization is shown through sitting close while also treating patients in a warm and friendly manner. Family is also a key value in this population as a source of emotional and physical support and should be made welcome in the decision-making process as necessary. The language barrier in this population, however, is one of the most prevalent challenges that we face today in the health care of these patients. It is crucial that we assure the understanding of what is said. Latinos do not like to show disrespect and will therefore agree with healthcare providers even when they do not understand what was said. This is why it is so important that we take the time to utilize the teach-back technique where patients verbally and physically demonstrate an understanding. Health is defined as a state of being free from disease or injury, and in Latino culture, it is a balance between the forces of hot and cold. Treatment in this population focuses on balancing the forces physically, spiritually, and mentally. Nursing considerations must be made across each age group of the lifespan in order to understand and accommodate special needs or challenges of each culture. For the Latino culture, it is important to recognize the bullets listed on this slide as special considerations for childbearing women and families in the Latino culture. Some of these beliefs and practices may or may not be followed by every person who is Latino, but it is important to talk with patients and assess their needs to assure that your education materials do not contradict their cultural practices, because if so, healthcare can be compromised. In Latino child, it is important to assess health in relation to diet, particularly when changing from breastfeeding or bottle to solid foods. We need to assure that the patient is obtaining important nutrients and is not suffering from failure to thrive. We also need to educate children of age about the risk of becoming pregnant, as well as ways to prevent it and STD transmission through the use of abstinence, condoms, and other forms of protection. In the adult population, we must assess for alcohol and drug abuse. We must educate about the risk associated and offer support groups of the same culture when needed. We should also screen patients, especially those new to the country, for tuberculosis. As with any patient population, we must carefully screen all patients for symptoms of domestic abuse and encourage open communication by using interpreters when needed and finding nurses of the same sex to help with concerns for modesty. We must also be sure to assess diet and nutrition, as Latinos are at increased risk for diabetes. In the older adult population, respect is of utmost importance, and we must be sure to address these individuals properly using señor or señora. We must also assess them for signs of depression related to the loss of loved ones. This age is also challenging, as they are more likely to use the folk medicine than the younger population, who is more acculturated. Communities are also a special consideration for nursing. It is important to recognize that Latinos come from various countries and may have slightly different language uses, as well as different beliefs and values. It is important to realize that in the community setting of healthcare, it is important to have pamphlets, posters, videos, and other means of providing information. It is important that the Spanish language is used properly for those materials in order to provide outreach to this vast community. In conclusion, culturally sensitive care for the Latino population is geared towards their values, beliefs, and practices. It is important to pay close attention to special considerations of each age group and to find a care plan that is suitable to each patient based on their needs. Thank you to each of these references for providing us with the much needed information to complete this transcultural nursing presentation. I hope you enjoyed it. Thank you.